Awesome. Well, thank you guys so much for having me today. I'm really excited to speak about oncology rehab. It's definitely something I'm very passionate about. I am the director of clinic operations here at Oncology Rehab in Denver, and I am board certified in neuro and oncologic physical therapy. So I'm a physical therapist. I've been a physical therapist for over 10 years and have worked oncology for the last 6. My husband is also a brain tumor survivor, so that is kind of what got me started in the oncology world. And he's doing great. Had surgery and 12 years ago, actually. So he's doing awesome now, and I'm just really enjoying giving back to patients. And I appreciate being a part of this, and also hearing all of the great programs that you guys have. I would love to share these resources with some of our patients as well. So I've kind of been asked to talk about what is oncology rehab. And I will try to give some community resources. I know a lot more about kind of what's going on here in the Denver area, but I tried to find some other things. If we've got patients, outside of the Denver metro area, how can they find therapists, and what does that mean? So really, what are we talking about when we talk about oncology rehab? We hear the phrase survivorship a lot, and we here at Oncology Rehab like to kind of start with patients even before they've had surgery. So we're really working on a lot of preoperative programs or pre-chemo programs, so we can help patients stay active during their treatments. We give handouts of exercises to do as maybe they're recovering from surgery. We also talk about kind of warning signs with chemo and how to help with fatigue and neuropathy, and even from radiation, how to keep some of their range of motion. So we're trying to see patients sooner and sooner in their time frame of their cancer journey. And then we see them throughout all of their treatments, and then into that survivorship phase of how do I get back to my life before cancer? How do I, find a way to get back to activities that I enjoyed doing before? Maybe I have to do them a little bit differently, but we really like to be a part of the team. So we work closely with medical oncology, radiation oncology, surgical oncology, even primary care physicians for patients who may be, 5, 6, 7 years out of treatment, but still having side effects. So that's really kind of our goal and where we see ourselves from a rehabilitation perspective with oncology. So we here are a multidisciplinary approach. We have physical therapy, occupational therapy, and speech therapy services. Here's some of our team members here at our Denver Tech Center location. But there's a lot more that goes into this. We work closely with trying to find patients nutrition help if they need nutrition help, or social worker help, or trying to utilize some of these other types of needs, or be able to help meet some of those needs of these patients. So we really try to look at the patient from all aspects, which sets us apart a little bit from when you think about traditional PT, OT, and speech therapy. I'm not sure if any of you have had that in the past, but a lot of times, say you sprained your ankle, you're going to go to therapy 2 or 3 times a week for 6 to 8 weeks, and then you're on your way. So we do things a little bit differently here. We might see patients weekly if they're in treatment, but then we, might see them every other week. Or, I have a patient right now that I'm seeing that doesn't like to have therapy the week of his chemo. So we take chemo week off. It's no problem. We don't want them to feel overloaded with appointments, which can happen with patients who have a cancer diagnosis. So we really try to work with the patient's schedule of what do they need and what are some of their goals to come out of therapy. We also really encourage exercise, physical activity, and making sure that they're doing some things on their own at home. We want them to take some ownership of their care and of their well-being. And so we teach them different skills that they need or adaptations, just kind of depending on what type of cancer diagnosis they have. We see all cancer diagnoses here. There's really no no limit. Initially, we primarily focused on breast cancer, but we've come a long way in the 6 years that I've been here, that I think, have seen every cancer diagnosis. So, it's really goal oriented for that patient. And it's all oncology focused. So all of our therapists here have knowledge in cancer and the behavior of cancer, the side effects of treatment, and what to look out for, any oncologic emergencies, and things to help kind of treat patients and take their whole well-being into stake. So how long has it been a specialized service? So Oncology Rehab was started here in Denver in 2009 by Julia Osborne. She's also a physical therapist. She was working at a kind of generalized outpatient physical therapy practice and started seeing some patients with a history of cancer and realizing that she didn't know much about it. And she didn't know much about, their treatments or their side effects or anything like that. And so she went on to create a clinic. When I joined 6 years ago, we had one location, and we now have 6, getting ready to be 7. So we've grown pretty significantly in the last 6 years. Julia also has created something called PORI, which stands for Physiological Oncology Rehabilitation Institute. And she founded this in 2017 to start to educate patients, or really educating providers on how to do oncology rehab. So we do courses, breast cancer, head and neck cancer, gynecological cancers, and then I teach a 3.5-day chemotoxicity and exercise course to PTs, OTs, speech therapists, exercise physiologists, physicians, nurse practitioners, really whoever in the medical field wants to take a course to learn more about kind of the rehab side effect of things. And we've now, with kind of COVID, we've learned how to do all of this virtually, and we've actually had participants from across the world. So we've had people from Australia, Singapore, Saudi Arabia, Abu Dhabi. We've had kind of a little bit from everywhere take part in our courses. The American Physical Therapy Association recognized oncology rehab back in the 1980s. So they actually had a subdivision of our academy in the 80s, but really hasn't been able to do much or provide much education until now. And now in 2019, they created a board certification in oncology, and there are, I believe, 4 of us in the state of Colorado that have this board certification in oncology. And then the Occupational Therapy Association and Speech Therapy Associations are still working on oncology specializations, not really something that has been well published or well publicized, but it's starting to become more recognized that it's needed. We even didn't get a lot of oncology in school. In PT school, I think, you get a day and all they talk about is lymphedema, which isn't the whole patient, right? Lymphedema is a big aspect, especially if patients have a significant amount of lymph nodes removed, but there's more to it. There's more to the side effects of fatigue, and there's more to the side effects that we can really help with from a physical perspective. And then UNCCRI stands for the University of Northern Colorado Cancer Rehabilitation Institute. This is in Greeley, Colorado, and they actually have a really large exercise physiology program. And then they have a cancer exercise certification program available to exercise physiologists and therapists who want to learn more about how to prescribe exercise for patients who have a history of cancer or a cancer diagnosis. They do a lot of research out of this facility, and I've got a slide in a little bit about research, but they offer one-on-one exercise 3 times a week with patients with one of their exercise physiology interns, and the patient will pay $85 for 3 months. So if you have patients that live kind of close to that Greeley area, this could be a great program for them to really start to get into more of a physical fitness and exercise while being closely monitored. And typically, here at Oncology Rehab, we're only an outpatient rehab program. There are some online home-based programs There's one that's based out of Findlay, Ohio called Maple Tree. I always caution patients sometimes to start off strictly on an online home-based program if they haven't been evaluated by anyone, because we don't want them, to do something that may cause them to have more pain or may, have some sort of side effect that we're not wanting. We really want to make sure that an exercise program is patient specific and individualized, because everyone responds differently to treatment. So, you could give 4 patients the same type of chemo and they're all may have different reactions to them. So that's the biggest thing, is as I start to, answer questions from patients from out of state or those sorts of things, I'm always making sure that they know that they still need to be assessed. There are also Livestrong programs at the YMCA. These are group-based classes that patients can participate in. Again, they're group-based, so you have to make sure that you have a patient who is willing to kind of stand up for themselves and say what they can and can't do. And sometimes that can be difficult. So we encourage them to have an evaluation by some sort of rehabilitation provider if they're going to start an exercise program. And then when is a patient appropriate for therapy, or when can patients even ask, like, hey, I feel like I need some therapy. We always want to work closely with our medical team, ensuring that that patient is safe to perform exercise and to move. But really we see them at any stage of their cancer recovery. And we know that early referral is going to yield the best results. So the sooner we can see patients and help mitigate some of these side effects, the better it's going to be for them, as well as, kind of improving their overall tolerance to their treatments. So we encourage patients to ask for referrals if they're feeling fatigued. There's really good research out there showing how exercise can mitigate fatigue. We think that it's, going to make people feel more tired, but it actually can help improve some of their fatigue. Weakness, balance disorders. We don't want patients with a cancer diagnosis falling. They're having bone density issues if they're on chemotherapy sometimes, and we don't want them to get fractures. So really making sure that they're safe. Pain is a good one. Any sort of surgical scarring or adhesions, to be able to help them work through that. If they have chemo-induced peripheral neuropathy, we also work closely with patients who have cognitive impairments or chemo brain, or I call it cancer-related cognitive impairments, because we see many patients who haven't had chemo that have significant cognitive impairments. Looking at women's and men's health, talking about sexual dysfunction with patients, urinary and fecal incontinence, constipation, pelvic pain, all of those sorts of things we can help with from a therapy perspective. And then lymphedema, which is probably a lot of the referrals that we still get, even though we can work with a lot of these other diagnoses, we still kind of get that lymphedema referral, and we want to help patients, be able to manage their lymphedema with daily activities and not have significant flares and swelling. These are just some different types of rehab. We can see patients from a preventative perspective, so beginning after that diagnosis and really trying to mitigate functional morbidity that can be caused by the disease. We also can do restorative rehab, which we're working with patients to kind of get them back to their premorbid functional status with hopefully no long-term impairments. We also can provide supportive rehab, attempting to kind of maximize their function, helping care, and for patients whose disease has been progressing or whose functional impairments are increasing and may not be reversible. So, we help them try to learn how to adapt to some of the changes that they've had in their lives and the way they function. And then lastly, we can help from a palliative care perspective, really trying to help these patients maintain as high of a level of quality of life as possible by relieving symptoms, preventing complications. We see a lot of patients who are metastatic or kind of entering into that end of life phase. And, it's rewarding for us to keep them at this high level of quality of life, and even educating caregivers on how to help position patients or help with pain relief and those sorts of things. So these are all of the things that we can help with from an oncology rehab perspective. And then what we do, so the patient would come in and be evaluated, and we look at their individual needs. So, are they having issues with pain? Are they having issues with balance, endurance, joint range of motion, strength, any functional impairments? And then we create goals with the patient and a plan of care that's going to focus on immediate goals of patient comfort and safety, and then progressing to long-term goals and returning to work. We have a therapist who's getting ready to start a program called Athletic Survivorship. And she's really looking forward to working with patients who want to get back and doing triathlons or marathons or some of those higher level sport-like activities because maybe they were really athletic before. And it's not always this younger cancer population, but we have patients in their 50s, 60s, 70s that have always been runners and they want to get back to running. It's what makes them feel good. So she's really working on a program to help them build their strength and endurance back up, because really we want them to thrive. They've been through a lot, and we want to help them continue to get stronger. Oops. So one program I wanted to talk about in particular today with some, not spending too much time, but we do have a chemotoxicity program. We know that there are certain types of chemotherapy that affect the heart and can have long-term latent effects of the heart. And so we want to help patients really be preventative and really be safe as they start to get back into exercise and just living their lives. So we really try to do some prehab testing and measures. We have a treadmill test that was put out by the University of Northern Colorado Cancer Rehabilitation Institute that allows us to accurately prescribe exercise for patients, and we can see how their heart rate responds to more intense activity. We do a cognitive screen and we look at sensation. We use something called a biothesiometer, which is basically an electrical tuning fork, to give us information about their vibration sense. So we know what's going on from a balance perspective early on, especially if they've had some pre-existing neuropathies or even diabetic neuropathy. And so we can make sure that we monitor them closely if they're going to have chemo. And then, we educate them on the start of chemo, side effects that they may experience, and when to return to therapy, also when to have conversations with their physicians. And then if they need skilled therapy at the time, we're going to treat them for balance impairments. We're going to treat them for strength and weakness and deconditioning, and any sort of prehab to qualify for surgery. So we've had patients who had pancreatic cancer who might have been appropriate for a Whipple due to their functional deconditioning. And I've personally had 2 patients that we were able to get strong enough so they could have a surgical procedure. So that's the other thing, that we can help patients with, is help them tolerate their treatments a little bit better. These are just a couple of research studies. With my background being neuro and working particularly with patients with brain tumors, we don't get a lot of brain tumor referrals sometimes because, they might not be, their end of life might be coming soon, and, they might not be thinking about, well, I should do rehab, but there's actually great studies showing how if we can get them doing some aerobic exercise, they get some improvement in aerobic capacity. And we can also see where they might be able to perform more activities with family, or they might tolerate their treatments a little bit better. And then the other one is more of a primary brain tumor, looking at physical and psychological needs. So a lot of our patients will have some psychological depression, anxiety. And there's been great work by the American College of Sports Medicine showing how exercise helps decrease anxiety and depression in these patients. If you're looking for great research opportunities, the University of Northern Colorado in Greeley actively performs both human and animal research. They've recently put out some manuscripts for lung cancer, cardiotoxicity, phases of exercise programs, as well as cancer and nutrition. And so I just put here Michael Lazio's information. He's the clinical director there. So if you have more questions, he's always willing to talk about the type of research that they do. And, if you have patients who are looking to get involved in research or, want to have some more specific exercise prescription, they can definitely go there and have some good assessments. And lastly, from our perspective, is it covered by insurance? Yes. Every patient has different benefits for therapy with their insurance plans, but in general, patients can get about 20 to 60 visits a year for all 3 disciplines of therapy. And we see patients for, that entire year. If we have a patient who only gets 20 visits, we try to, kind of maneuver our visits around important milestones of their cancer treatments, or we also have self-pay options. And really, we try to encourage patients, if they're reluctant to come just for one visit, just learn what we're about. Sometimes when people are referred to therapy, they get a little nervous because they think we're going to make them work really hard or that we're going to cause them pain. And obviously those are not our goals. So once they get in the door and they see that we're knowledgeable in cancer, that we're knowledgeable in their treatments, their surgical procedures, they tend to come back a little bit more, and that we're not trying to see them 2 or 3 times a week. We're not trying to overload their schedule. We understand that they need to rest, but they also need to move. And these are our oncology rehab locations. So we have one here in the Denver Tech Center, which is where I'm at right now. We have one in Aurora, Cherry Creek Centennial Medical Hospital. We're getting ready to open one on campus at Rose. And then we are in Greeley in the UNCCRI building. And Becky, I see you put a question in real quick. If someone's uninsured or underinsured, is there a sliding scale or other options for care? So yes, we do have a self-pay option, which is significantly lower than what we offer, what some insurances will pay. All of our locations, except for the one in Greeley, are partnered with HCA. So some of our HCA locations have charity care that patients can apply for as needed. So we do try our best to see patients for as long as we can. We have also done some kind of off the books treatment for patients if they really need it, because we understand the importance of rehab. So yeah, we try to talk to them and figure out what's going to work best for them. But we do have options. Great question. And then these are just some ways to find other oncology rehab specialists, because I know it's difficult. So PORI.org is our education company here at Oncology Rehab, and we have a Find a Therapist section. So this is across the states and the world, actually. But they can search for what type. So if they want a provider who has done breast cancer, or if they want a head and neck provider or a chemotox provider, they can put in the course and put in like the zip code and see if there's anything around them. There's also oncologypt.org, which is our American Physical Therapy Association. All PTs, you can find oncology practitioners that way. And then there's also a clinical exercise specialist, which is people who have gone through UNCCRI's cancer exercise credentialing program, which is a week-long course. And that, again, is also worldwide. I think they have some exercise physiologists in Puerto Rico and South Korea and a little bit everywhere. And you can always feel free to contact me. I've got lots of resources across the US. I also lecture for the American Physical Therapy Association. So I know lots of people in different parts of the US, and I am always loving to help facilitate care of patients or anyone's needs. Yes, Carlin, I would love to talk a little bit more about Prehab. So we have various types of Prehab programs, kind of depending upon what the patient is going to undergo. And really the first session is getting a lot of baseline measures. So we do a baseline cardio treadmill test. We do baseline balance testing and strength testing. And then we give them handouts about, what type of, depending on what type of cancer they have, what are some exercises that they should start doing? If a patient's having breast cancer, then we want to see them 3 weeks post their surgery to make sure that they're okay. If it's someone who has pancreatic cancer, I might not see them till 6 weeks post, depending on if they had to go to a skilled nursing facility first. And so, with that pancreatic cancer patient, I teach them how to diaphragmatically breathe. I teach them how to activate their TA or transverse abdominis, because once they have this huge surgical incision, they're not wanting to move. The other big thing is, we don't think about this, but we ask patients to do a sit to stand test. So they have to stand up 5 times repeatedly without using their arms. And if they can't do that, then it kind of gives a little bit of a red flag for us, because if they've had any sort of chest surgery, abdominal surgery, gynecological surgery, and they're trying to push with their arms every time they stand up, their mobility is going to be really poor. So it gives us an idea on how they're doing. We look at bed mobility for some of these patients and try to teach them and their family members how to help them get out of bed versus pulling on their arms. And then we also start them on a kind of aerobic conditioning program. So within those first 6 weeks of after surgery, we don't want their heart rate to go above 100 because we need them to have good blood healing to the area where they had surgery. So we, try to start them on an early walking program and teaching them how to monitor if they're doing too much. And then in some patients, we have to teach them how to do a little more because they're not doing enough. So that's really what we found. We have found this prehab program to be so beneficial because it just allows patients to feel a little bit more comfortable with their activity going into surgery. And then we also do a little bit of the same before chemo. We don't typically see them as often if they're going through chemo unless they're having side effects, but we've taught them how to do strengthening and cardio exercise during chemo as well. Any other questions?
Yes, let me get back on the screen here a little bit. So I have some questions that I'm not a very fast typer, but I wanted to offer. So I work a lot with women who are recovering from ovarian cancer surgery and treatment. And one of the things that are curious to me, because Oncology Rehab isn't recognized necessarily by all clinics as something that they offer or present for patients to consider. So how does a patient ask for Oncology Rehab, and how would they know what particular discipline they might need? Say, for example, just determining, do they have poor core strength because of abdominal surgery or whatever that might be? How do they know what to ask for and how to ask?
Yeah, that's a great question. So we tell our patients that anytime they feel something that's not normal, or if they start having difficulties with their activities of daily living. So if they start noticing that they get short of breath going up the stairs, or if they have trouble standing up, or if they're just really fatigued and want to find out some things that they can do, or if they start having numbness and tingling, or I work a lot with the vestibular system. So if they start having dizziness, that's not this lightheadedness from not drinking enough water, but if they're, feeling like they're on a boat all the time, we encourage them to ask their physicians for a script for rehab. What we do here at Oncology Rehab is when we get a prescription in, we usually ask the physicians for their last office note. And then we have a patient navigator. So we have a navigator who goes in and looks to see, okay, they're coming in for weakness. I'm going to refer them to one of these 4 therapists. So the patient doesn't have to say, I need physical therapy or occupational therapy or speech therapy. We kind of do that based off of what the script from the physician says.
Okay. And so some of the issues that I deal with the women I talk to have pelvic floor weakness, as well as they have incontinence related to the part of bowel surgery they might have experienced if they didn't get an ostomy, but they have problems with constipation and diarrhea and, constantly going back and forth. It was curious to me that you had actually support for that type of incontinence, and then a lot of pelvic floor therapies are not necessarily always recommended for women until, somebody asks specifically.
Yes. Yeah. So we have, I think 5 providers now. We have PTs and occupational therapists who do pelvic floor rehab for our patients. And, it's not my area of expertise, but they definitely work individually with those patients based off of what their complaints are. So, we, a lot of times we'll think about, that we need to teach patients how to do Kegels, or tighten their pelvic floor. But if a patient's had radiation to their pelvis, sometimes their pelvic floor is too tight, and they have to actually learn how to relax. So our therapist will evaluate them to see, what exactly is going on and determine which treatment is best for them.
And so what kind of therapy would you actually recommend that would be beneficial for constipation or urinary incontinence, in terms of even fecal incontinence that some people experience?
So I know that our therapists here, do have particular exercises that they do with patients, particularly trying to get the pelvic floor muscles to start to function again. They do some internal work to release trigger points on certain muscles that might be causing, the contraction to not be as smooth and strong. We have biofeedback units where the patient can actually start to feel and hear a signal of their muscle tone. And then, core strengthening. And then we also, I think those therapists will work as well with some nutritionists that, to make sure that the patients are eating appropriately as well, and staying hydrated. And then any patient that's had any sort of chemo, we get on an aerobic exercise program too, which will also help with some of that constipation.
Well, Franny, thank you so very much for sharing your time, your talents. Clearly, it's an important topic, and we will have to definitely have you back to share your passion and your talents. You've made life better for so many, so thank you so very much.
Awesome. Thank you guys so much for having me. I really appreciate it.
Yeah.
Thank you.